full body blood test checkup is normal. So there can't be any serious digestive health issues. If that is what you think, you can be completely wrong. As a gastroenterologist, in this video, I will show you how serious gastroenterology diseases in our country are being missed because people are blindly going by these so-called full body blood test reports and miss various gastrointestinal diseases. Stay until the end and I will go through how this misbelief can sometimes miss serious disease. Think of blood test like checking for smoke in the air. Just because you don't see the smoke, it doesn't mean that there is no fire. Digestive organs can be getting damaged quietly without actually impacting on the blood test values. Blood tests are screening tools. They're important. They're not going to be the true machines that is going to tell you exactly what is going on in your gut. This misunderstanding is why so many times we see gastrointestinal, liver, pancreatic disease presented late. First one, cancers. They don't show on the blood test. This is where we need to pay attention. Early digestive cancers, they are silent in the blood. Colon cancer, esophageal cancer, stomach cancer, pancreatic cancer. In the early stages, your blood tests, including hemoglobin, can be normal. Your liver enzymes can be normal. Sometimes the tumor markers, which people get it checked, can be normal and they can mislead. Cancer changes symptoms before it can start actually changing in the blood. So waiting for blood tests to become abnormal, it's like waiting for the fire alarm to sound loud despite knowing that there is a fire inside the building. Let us now talk about liver. Liver disease is one of the common things that we see that hides behind normal reports. Fatty liver now is so rampant in the world, especially in countries like ours, India. There is 4 out of 10 people in the cities have fatty liver. In the early stages of fatty liver, liver enzymes are often normal. Shockingly, sometimes even with cirrhosis, you might not see jump in the liver blood test. You can have fat, you can have inflammation, you can have scarring in the liver. Your liver blood test might look actually normal. Even a lot of fibrosis, silent damage that occurs sometimes can exist with you having a normal liver blood test report. This is where ultrasound scan, fibroscan, they can help what the blood test can miss. So normal liver test doesn't mean that your liver is functioning normally and there is no disease inside the liver. Other costly mistake which many young Indians are making is with inflammatory bowel disease, IBD, loose stools, urgency, abdominal pain, mucus, blood in the stool, losing weight. They have some blood tests, so they get this reassurance that they are all normal. They then go and have an ultrasound scan that also comes back as normal. They think the ultrasound scan is going to scan their stomach, intestines. Ultrasound is mainly for solid organs, not for the stomach, not for your small or large intestine. Everything is normal, so they assume that, okay, this must be IBS, irritable bowel syndrome, where there is no disease. But early inflammatory bowel disease can hide with normal blood tests. IBD is not diagnosed purely on the blood tests alone. It is diagnosed by certain markers of inflammation in the stool. Sometimes we have to do further investigations, endoscopy, colonoscopy, at times CT scans. You cannot diagnose inflammatory bowel disease purely by blood test alone. Neither you can dismiss somebody saying that you don't have inflammatory bowel disease just because your blood test, you had an ultrasound that is normal. This is one of the common mistakes I see even many general practitioners are doing. Patients come to us quite often with bad stage of inflammatory bowel disease because they have relied time and time again on blood test or an ultrasound scan. Why does this keep happening? That's because blood tests are easy to do. There is no preparation that is required, no fear. It's easy to get it done and you get quick reports. You can interpret it yourself. Okay, it all looks normal. Digestive diseases to diagnose sometimes requires in-depth. We need to look into as to what is causing the issue. Obviously, no one will be jumping with joy to undergo endoscopy, colonoscopy examinations because it requires effort, it requires courage. There is also fear. A lot of people think bad things or something will happen to them. Or sometimes it's just that they are scared about the outcome. What if the endoscopy, colonoscopy finds out something? They don't want to know the actual problem. By running away from the problem, you're not going to get rid of the problem. So there is heavy reliance on these blood tests and simple ultrasound scans, which is not going to pick up your gut issues. There is no such thing actually as a full body blood test as far as the digestive health is concerned, because digestive health problems require real evaluation. Firstly, especially sitting down with the patients to go through their symptoms in detail, the pattern, their risk factors, dietary habits, lifestyle. Then comes the test. Blood tests are just one piece in the puzzle. They're not going to give you the entire diagnosis. So when should normal reports on the bloods not be taken for granted? If you have symptoms such as persistent abdominal pain, new onset and worsening constipation, chronic diarrhea, blood in the stools, unexplained weight loss, long-term acidity, long-term reflux, constantly feeling tired with gut symptoms, excess of bloating that's not getting better, severe flatulence, you might also have difficulty in swallowing. So these kind of symptoms should not be ignored because of the blood test being normal. Symptoms always speak before the blood tests do. Blood tests are of course helpful. They're good for picking up certain things, like let's say if you want to check cholesterol, if you want to know if you have diabetes, if you are iron deficient, if you have B12 deficient, vitamin deficient, calcium, thyroid levels, because these also can affect the gut. But blindly believing in blood tests for digestive health issues, it's going to be dangerous because digestive diseases can hide quietly. They are found only if we do the right test and also look in the right place. This is where, if the symptoms are bothering you, you can forget about the normal blood test. You need to consult the right professional, your gastroenterologist. Thank you.